Well, joining me via Skype to discuss the rising cases of COVID-19 in Nigeria is a consultant public health physician, Dr. Modupe Akinyinka. Good morning, and thank you for joining us on TVC Breakfast.
Good morning. Good morning.
Now, daily Nigerians wake up to new figures, rising figures rather, of coronavirus in the country. What concerns do you have with regards to this?
My concerns are numerous concerning this rising figures, because now we're having so many more cases, and some people still seem not to believe that there is COVID-19 in the country, which is, I don't know what to say about that, because it's everywhere in the news, it's all over the world, all right? So people should know that this is with us and that we need to do something. We need to take personal responsibility for it, because there's no way that the government is going to keep everybody at home for such a long time on lockdown, and then after the lockdown, we're now going back to, back to zero again. So we need to take personal responsibility. Each person needs to take personal responsibility and make sure that we take these precautions that we now all know already. Using our masks and then washing our hands very frequently and not touching our face, and then socially distancing, or what we would call physical distancing, really, not being too close to other people, avoiding crowded areas, right? So that this huge number of cases do not, multiply so much that our system cannot cope with it, which would be a real problem.
At some point, you mentioned the lockdown, and I'd like for us to look at that period when we had that lockdown in place, and so much effort was put in place at that point. With the rising figures, would you say that not much was done at that period to achieve, because the essence of the lockdown was to ensure that we do not have as much spread of the virus?
Oh, I wouldn't say that not much was done, because if you compare our figures with the figures of other countries that had a case, or that had their first case at about the time that we had our own first case, which was late February, if you compare the figures that we have, you find that ours are not so much. We don't have as many cases as they have, which is because we were able to lock down early enough, at least reasonably. It could have been earlier, but at least reasonably, we were able to do that. And in doing that, at least we reduced the number of cases. Public health strategies could be put in place, so we could have good contact tracing at that point in time. And so we were able to at least address and try to flatten our curve. Flatten our curve means we're reducing the number of cases that come up, and then kind of like making it easier for our health system to be able to deal with it. And so we were able to do that to a large extent. But now that the lockdown has to be eased, because we can't be on lockdown forever, and so the lockdown has been eased. And because our type of population, we're a population that, most people earn their income on a daily basis. And so if you keep them locked down, then you're going to keep them hungry, and it's going to, have untoward effects on them. And so because of this, lockdown cannot, continue. So everybody now needs to know.
But would you say, if I may interrupt your line of thought, would you say that this is the right time to ease the lockdown? Because there's been lots of controversies with regards to easing of the lockdown, especially when you place it side by side the rising number of cases.
Yes, the lockdown will have to be eased, because we cannot permanently be on lockdown, like I said before. So the lockdown definitely would be eased and is being eased. But with the rising number of cases, what that tells each person then is that, there's still so many cases out there, and so I have to take personal responsibility. Now, the communication of the risk may be something that is going on. How do people perceive the risk of infection that they have? Okay, fine. We know that with COVID-19, up to about 80% of those that get infected may be asymptomatic. But even if you are asymptomatic, there is still the chance that you can transmit it to somebody else. And in your house, there may be people that are really, really vulnerable. So if you still go out and you don't take those precautions, then you are increasing the number of people that will have to make use of the health system. And so you're burdening the health system. So it still boils down to that fact that we need to take personal responsibility, and then we need to take all those conditions, all those strategies, we need to take them seriously. I see people going up and down without masks many times in crowded places, totally disregarding physical distancing. This is not the time at all to be doing that. This is the time to be seriously taking those matters like we need to do them. So physically distancing from others as much as possible, even as we have to go about our daily bread, because if you do not ease the lockdown, there's the chance of the population can start to revolt, because so many people were staying at home. You know about the issue of the 1 million boys, the insecurity, and then all of that. So all of those things, you have to balance them with the fact that people, need to be healthy. So public health has to be balanced also with the economics.
Now speaking about the use of face masks, there's been some controversy around it. Some public health experts also say that it is not right for persons to use, especially persons who are not infected, to use the face mask. And then there's also the controversy with regards to the prolonged use of face mask, that it could generate some other health challenges in people who may not even be infected as well. Could you help us better understand how best to use the masks at this time?
Now, the masks are there in order, because they are not, we're not advocating that medical grade masks should be what people are using all over the place. So they are homemade masks, and those masks, what I have found about the masks is that when the masks are comfortable, then people are able to use them for a longer period. So it now becomes something that each person has to be able to get a mask that is comfortable enough for him to wear. And then, of course, the mask shouldn't be worn for prolonged periods, which means that we shouldn't be out there for prolonged periods. For example, once you get to your office, once you're going to, on the way to work, of course, you will be in a public place, so you wear the mask. But once you're in your office, then you don't need to wear the mask anymore, right? And then you can remove it. And then when you're out in the public or in a crowded area, then you wear the mask. So that is kind of like trying to tell us that you shouldn't really be out in, a public place for too long. You shouldn't be in a crowded place for too long. Just spend minimal time there and then go back to where you can then remove your mask. So it's something that we all need to learn to do. Get a mask that is comfortable enough and that can cover the nose and the mouth, and then still enable you to be able to breathe adequately, so that you are not compromising your own intake of air for breathing. So you need to get a comfortable mask and be able to use it. Besides, it's become law anyway that in a public place, each person should use a mask. And the advantage of us using these masks is that with the mask, whether the person has symptoms or not, the person may not even know that they have symptoms. All right, the person may not even know that they have COVID because they may not have symptoms. You understand what I'm talking about? So if the person doesn't have symptoms, all right, and the person is wearing the mask, then the person is also, protecting other people from getting infected.
Okay.
All right, even if the person is infected.
All right.
As well. So if you wear the mask,
let's leave the conversation here for now. Modupe Akinyinka, thank you so much for speaking with us.